Assalamu alaikum now. I would like to talk about the differential diagnosis of the heel pain. For remembering the heel pain, we have to make our schedule packed. P-A-C-T. So plantar fasciitis, Achilles tendinopathy, calcaneal stress fracture and tarsal tunnel syndrome. Plantar fasciitis, maximal pain on first stepping out of the bed, maximal pain on first stepping out of the bed, pain and tenderness, pain and tenderness at the medial plantar heel, pain and tenderness at medial plantar heel, worse with dorsiflexion, worse with toe dorsiflexion. So pain and tenderness at the medial plantar heel, worse with toe dorsiflexion. Achilles tendinopathy, there is posterior pain. There is Achilles tendinopathy, there is posterior pain. In Achilles tendinopathy, there is posterior pain, swelling and tenderness. There is swelling and tenderness 2 to 6 centimeter, swelling and tenderness 2 to 6 centimeter proximal to the tendon insertion, swelling and tenderness 2 to 6 centimeter, swelling and tenderness 2 to 6 centimeter proximal to the tendon insertion, proximal to the tendon insertion. Calcaneal stress fracture. In calcaneal stress fracture, there is pain that is worse with activity, pain reproduced by medial lateral squeezing of the calcaneus, very high yield. Pain reproduced by medial and lateral squeezing of the calcaneus. Pain reproduced by medial and lateral squeezing of the calcaneus. And tarsal tunnel, there is pain and paresthesia numbness on the sole of the foot. Pain, paresthesia numbness on the sole of the foot. And percussion tenderness over the posterior tibial nerve in the tarsal tunnel. Percussion tenderness over the posterior tibial nerve in the tarsal tunnel. So in we can do the MRI for diagnosing calcaneal stress fracture. This is the fracture, this is the stress fracture, and it is diagnosed via medial lateral squeezing of the calcaneus. It is diagnosed via medial lateral squeezing of the calcaneus. Okay, so this is the way of diagnosing heel pain. It's a very small video where we can find the gist of the diagnosis. Okay, in plantar fasciitis, if we go in detail, plantar fasciitis risk factor is pes planus, obesity, and on exercising working on exercising on hard surface. It is pain at the plantar aspect of the heel and hindfoot. Pain at plantar aspect of the heel and hindfoot, worse with weight bearing, especially after prolonged rest. There is tenderness at the insertion of the plantar fascia, pain with dorsiflexion of the toe, and presence of heel spur on the X-ray, which has low sensitivity and specificity. In plantar fasciitis, activity modification, stretching exercise, and heel pad or orthosis may be used. Heel pad or orthosis may be used. And Achilles tendinopathy, the next one, it is usually posterior pain and usually happens in the athletes, often triggered by an increased exercise regimen. And the calcaneal stress fracture, we know that pain that worsens with activity, and weight bearing pain is elicited by pressure at the site of the heel. Calcaneal, if we do the calcaneal squeeze test, the medial lateral squeezing, then it can cause pain. So it happens, it can occur in high impact exercise program like running, that can cause repetitive microtrauma. So calcaneal stress fracture can happen in high impact exercise program. And the tarsal tunnel syndrome, it is happened, it is due to percussion and tenderness over the posterior tibial nerve in the tarsal tunnel. So that is all about differential diagnosis of the heel pain. Hope you enjoyed.